Valley Hospital, Medical Center of the Rockies, and Greeley Hospital, as well as our affiliated clinics, through donations made by generous community members. Donor contributions help to fill in gaps not covered by insurance, accelerate advancements in medicine, and ensure the very best healthcare for our region. Community support like yours helps us to care comprehensively for the health of our community. The foundation disperses an average of more than $3.4 million a year to support a broad spectrum of programs at our Northern Colorado hospitals and clinics. A couple of recent examples: donor dollars supported the purchase of imaging equipment used during surgery for breast cancer patients. This makes surgeries more efficient and reduces time under anesthesia. Additionally, through donor generosity, a local COVID-19 biobank project in partnership with Colorado State University is helping us to prevent, control, and treat this disease, and will help us prepare for future pandemics. We'll provide an opportunity to ask questions at the end of Kevin's presentation today. To ask a question or to share a comment, click on the question mark icon in the top right corner of your screen, then type into the Ask a Question box and click the arrow to submit. With that, it is now my pleasure to introduce Kevin Unger, President and CEO of UCHealth Northern Region.
Well, thank you, Erica, and thank you, everybody, for attending this by video. Hopes are that next time we can be doing these updates in person potentially. And so this is kind of the state of the state as we sit today. And it is, things are looking up here within the hospitals, to the point where I am not even going to lead with discussions about COVID, but I'll close this talk with kind of where we sit with COVID-19, which will be probably the first time in 2 years where it hasn't been really the hottest topic out there. And so my goal today is just to go around the horn, give you all updates on what's happening at each of our different facilities and here in this market. And then I will give a COVID-19 update at the end, and then I'm happy to answer any questions that you might have as well. But once again, thank you for your support. This community has been incredible. We live in a wonderful place, and it's because of people like you. And so I will open with what's happening with our Greeley Hospital. And so the Greeley Hospital has now been open for 2 years, of which have all been really pretty much COVID related. So they opened on July 3rd. And so by the end of their first year, they were in the midst of this pandemic. The facility has actually been full from day one. As soon as we opened it, we filled all the beds there. And so it's been very well received in the Greeley market, and we need to expand. And so we are currently in the process of designing and building out the 4th floor of the hospital. It was shelf space, and we're going to be adding some additional progressive care beds. And just to put it in context, just how busy the Greeley Hospital is. And so in the last 2 years, they've had over 5,000 discharges from the facility, delivered over 600 babies, as well as seen over 25,000 people through the emergency department. And here at we're at Medical Center of the Rockies. I probably should have let you know where we're filming this from, but we are at MCR. In MCR, many days, the Greeley Hospital saw as many people through the emergency department in Greeley as we see here at Medical Center of the Rockies. And so a lot happening there, as well as we took over EMS services on December 1st for the Greeley market. And so the first week that we took over those services, 5 of the 7 days, the Greeley jurisdiction saw their highest volume of EMS calls and 911 calls in the history. And so our team stepped up. They did an amazing job of really making sure there was no gaps in service that was provided. And they did it kind of being fresh and new to that market. Since we have taken over those services, the 911 and EMS services are up about 60% from where we had projected they would be. So we're currently hiring 50 new EMTs and paramedics to kind of fill that need, as well as we have 6 new ambulance rigs that are on their way to Northern Colorado to also fill those needs as well. So it's been widely successful. I want to thank the EMS team. They've done an incredible job of stepping up and really making that transition in Greeley successful. We appreciate Greeley Fire as well as the town of Greeley for putting your faith in us as it relates to EMS services. Which brings me to Medical Center of the Rockies, which is where we're at right now. So 15 years ago on Valentine's Day is when we opened up Medical Center of the Rockies. And so if anybody was around and you remember, we threw the party of a lifetime here in Northern Colorado when this facility opened. I don't know if anybody online remembers that, but I was up on kind of the overlook up on the top floor here at MCR, and it was like Field of Dreams. There was just headlights and cars coming from all directions, and it has been a success since we opened up Medical Center of the Rockies, to the extent that we are always searching for bed capacity. And so we will be adding and have added about 6 or 7 new additional beds that we've been able to find space and renovate and turn into patient care areas. But I believe by my next update, we'll be talking about some additional ways that we have planned to expand Medical Center of the Rockies. Another very exciting thing that's going to be occurring here at MCR is that in May, the state of Colorado will be coming and doing their survey for us to become a level 1 trauma center. And so what that means for the hospital is even quicker response times to a lot of our trauma patients, but that there will really be no need to transfer patients out of MCR from here in Northern Colorado or Wyoming or Nebraska. We will have a full suite of trauma services available, and we're looking forward to make sure that that survey goes well, and that Medical Center of the Rockies, by the next time we talk, will be a level 1 trauma center, as well as we are adding a new service with the help of philanthropy and the foundation. We now have a new gyne oncology service that the foundation was able to provide some equipment for, and we have a new provider that is starting, and we're very excited to provide those services here in Northern Colorado. Okay, now I'll move to Fort Collins and Poudre Valley Hospital, which will be celebrating its 100-year anniversary next year, which is quite remarkable. And so I know that these last 2 years have been challenging. I anticipate that Poudre Valley Hospital over its 100 years has seen a lot of different challenges. And if you've driven recently by Poudre Valley Hospital, it is truly quite a construction zone. We've been in the process of doing a lot of demolition in order to upgrade and implement what we have called the master plan. And so the first phase of our master plan is really to increase and enhance our cardiac and vascular capabilities back to Poudre Valley. So when we opened Medical Center of the Rockies, we moved a lot of our cardiac capabilities and trauma capabilities to this facility. And now it's time to go back to Poudre Valley and enhance and kind of expand our CV and vascular services at Poudre Valley Hospital, as well as we'll be updating our birthing centers, our women's care unit, and other areas, including the front entrance to the facility. And so if you've been to Poudre Valley lately, the entrance, of course, is on the backside, and that will not be changing. I think our community's kind of gotten used to circling around off of LeMay to enter. But our registration area is less than desirable. As I travel the Eastern Plains and many of the rural hospitals in Nebraska and Wyoming, every single hospital has a much more inviting and welcoming entrance than we have at Poudre Valley Hospital. So we are excited to expand and kind of increase the lobby area, as well as make it much more inviting for our patients as they enter PVH. Today, we also announced a very exciting project, which is kind of the second phase of the master plan, which is we will be moving Mountain Crest and our behavioral health beds into or back into Poudre Valley Hospital. So there's a kind of an urban legend that we have behavioral health services on the second floor of Poudre Valley Hospital. The reality is there is no second floor at Poudre Valley Hospital, and so when we added on to PVH from the original what we called the A building, it didn't sync up as it relates to the floor heights, and so we eliminated the second floor because it just didn't sync up, and so we currently don't have behavioral health services at PVH. But we will. And so we do have some shelf space right across from our current orthopedic unit that we will be building out, as well as taking over the current ortho unit to build out 50 beds of behavioral health services at Poudre Valley Hospital. Why we're excited about this is, one, we'll be expanding our bed capacity around behavioral health from 42 beds to 50 beds, of which most will be private rooms, which is not necessarily the case currently at Mountain Crest. Also, kind of the front entrance to Mountain Crest has been our emergency department at Poudre Valley Medical Center in the Rockies. And so now, instead of having to transfer patients from PVH to Mountain Crest, it'll just be an elevator ride up to the new unit. It will have an outside open atrium, which will be on the rooftop, to allow our patients to get outside and get some fresh air. We're going to be providing ECT services, which is also kind of becoming the norm in behavioral health treatments, and that will be on site, as well as our outpatients behavioral health services will be moving across the street to the first floor of the West Bridge office building. And so that will be an incredibly nice location to provide those behavioral health services as well. It used to be 21 trees, and now that will be where our outpatient behavioral health services will be provided at Poudre Valley Hospital. This has all been made possible by a lot of organizations and people stepping up and providing some philanthropic support of the master plan at Poudre Valley Hospital. And I thank you very much for that support. And we're very much looking forward to our continued upgrades and expansion of services at PVH. We also now the hospital in Steamboat is part of UCHealth. It's called Ampa Valley Medical Center. Ampa Valley's gone through a lot of transitions over the past year as well. They opened up a brand new emergency department. They were in the same state as Poudre Valley was, with curtain dividers and really a lack of privacy. The new ED is spectacular, as well as we've opened up a new urgent care center right on Main Street. So if people are up and out and about up in Steamboat and you get nicked or sprained ankle or need basic medical services, that the new urgent care center will be there and ready to assist you. And it's very prominent there on Main Street up in Steamboat Springs and affiliated with the Ampa Valley Medical Center. Another really kind of key initiative for the Steamboat market is to figure out an employee housing strategy. It is incredibly expensive and challenging to recruit into that market. And so housing has been a big limiting factor, and we're putting in plans in place to meet the needs. And I will be talking about staffing shortages and kind of where we sit here in Northern Colorado as it relates to staffing here in just a moment as well. Our clinics, University of Colorado UCHealth Medical Group continues to expand. We'll have some exciting announcements about expansion of primary care throughout the Northern Colorado market coming here shortly. And they've done an incredible job of really stepping up and meeting the needs as COVID-19 continued to rage during the pandemic. Many of our staff members that traditionally work in the clinics were willing and able to step in and provide services within the walls of the hospital and vice versa. And so the amount of teamwork that occurred with our providers was just exceptional, and they did a wonderful job of really meeting the needs of the pandemic. So as you can hear, new baby born here at Medical Center of the Rockies brings a bit of joy to everybody when we hear the Brahms lullaby playing overhead. And that would be our 25,001 baby born here at MCR over the past 15 years. And so we've delivered just over 25,000 babies here at MCR since it opened 15 years ago. Community benefits. So this is an important component of our mission as UCHealth. And so we are a not-for-profit organization, and we very much appreciate the ability to give back to the community. UCHealth gives back $334 million a year in community benefit, of which $120 million of that is uncompensated care. But through those different programs, for instance, the Aspen Club, the Healthy Kids Club, our diabetes education group, much of that is unreimbursed, and is we wouldn't be able to provide a lot of those services without the foundation giving us some financial assistance, but also without having the commitment from the health system to provide services for this community. And so we're happy to do this. It is an honor for us to serve the community, and we want to make sure that we are on solid footing as we move forward. And so I will touch quickly upon some of the challenges that we're looking down the barrel at this moment. And so as I talk to many of my colleagues, not only in healthcare, but in other businesses as well, staffing is certainly a challenge. Healthcare is projected to grow by about 16% over these next 10 years, and that's going to require additional staff, not only within the UC health system, but nationwide. We are all fighting for a limited number of people that have the skill set and the talent to provide the services for us. And so we have really taken the approach within the health system that we're going to have to grow our own. And the first step in really actualizing this is a new program that you may have read about in the Coloradoan, which is called our Ascent Program. And we have partnered with a company called Gould Education to put together career ladders and make sure that we're providing support for people to enhance their careers, go get that certificate or that bachelor's degree. And Guild will provide kind of the support that it takes to make that happen. Many of our employees in our workforce just have not been exposed to higher education or certificate programs, and Guild will step in and make sure that that transition and that process works flawlessly and seamlessly to make sure that people can advance, get a higher level of education and move up within the organization. We're also looking at new and improved ways to partner with existing relationships that we have with CSU, UNC, Ames, Front Range Community College to really make sure that we are continuing to give people opportunity to advance their education and advance their career within the health system. Now, we have had success hiring. Just since July, we have hired over 2,400 new employees that have joined us here in Northern Colorado. But with that said, we still have 700 open positions that we're working to fill. And so the Great Retirement or resignation has been real. We've witnessed anybody that's within like 3 to 5 years of retirement saying, I'm gonna take this option a little earlier than what we had anticipated, and we know that we're going to need to train our own to continue to provide the services that we want to and that we need to within these communities. And then I will close quickly with a COVID-19 update, and it is it's an awesome update because we have seen our number of COVID positive patients just decreasing significantly over the last couple of weeks and days. And so yesterday when I pulled these numbers as a system, we had about 145 COVID positive patients in beds throughout the UCHealth system. Today it's 135 patients, and so it's dropped by 10 just overnight. Of which about 43 patients are here at MCR, Poudre Valley Hospital, or in the Greeley Hospital. And we do have 18 patients that are still in our intensive care units that are COVID positive. But it is getting a little more challenging to figure out if COVID is their primary diagnosis of why they're here, or they came in for other reasons and they tested positive for COVID while they were in-house. Our guesstimate, and this is not a scientific numbers by any stretch, is that probably half of our COVID positive patients were incidental findings, meaning they just came in for other things and tested positive for COVID. But our hospitals are always full. This is a busy time of year. We just had a surge alert come over the overhead here at Medical Center of the Rockies for the emergency department. And so we are continually looking how we can expand and continue to provide a high level of access for our communities. Our focus is a strong focus on behavioral health, providing access and suicide prevention. And I know that there was a slide that I may have already passed over that kind of outlined our community health initiatives, but our goal is truly to keep patients out of the hospital, move our services more upstream and outpatient, and try to keep the communities as healthy as we possibly can. And with that said, we are so lucky to live in a community that we live in. So throughout the pandemic, our community stepped up in a multitude of ways. The first calls I received as soon as the pandemic really started heating up was from local businesses, including Otterbox and Woodward, saying we have PPE. If you need it, it's yours. Colorado State University, President McConnell, she called and said, anything we have is yours. UNC did the exact same thing. And then just individuals in a multitude of ways were there to support staff. The howling at 9 o'clock was awesome, really picked up our staff members' feelings and, kind of helped them through the burnout phase of the pandemic. We had clowns show up at Poudre Valley just to cheer up the emergency department. Food from all sorts of restaurants and individuals was showing up, and that doesn't happen everywhere. So we do thank each and every one of you for what you do, your support and your interest in UCHealth. And with that, I will turn it back over to Erica to ask any questions that may have come through.
Thank you so much, Kevin. That's a great comprehensive update on so much that's happening here in Northern Colorado in healthcare and at our hospitals. We did have a couple of questions come in through our chat box. So I'll start off. One question related to Poudre Valley Hospital. Will be expanding heart and vascular services there. What does that mean for the offerings in heart and vascular care at Medical Center of the Rockies that currently exist?
Yep, we'll continue to grow the services and the offerings here at Medical Center of the Rockies, as well as at Poudre Valley. So we won't be moving per se anything from MCR back to Poudre Valley. It'll just be in addition to the services that are currently offered here at Medical Center of the Rockies. We will not be performing open heart surgery at PVH. That will still take place here at Medical Center of the Rockies. But cardiac catheterization and some other high-level cardiac and vascular services will be offered at Poudre Valley Hospital once we get the space renovated and up and running. And the Heart and Vascular Clinic within UCHealth has been really working hard to staff up and make sure that we can provide a high level of care at all of our locations.
Great. Two questions then related to behavioral health. How does the move of Mountain Crest to Poudre Valley Hospital mesh with the building that Larimer County is building?
Yep, and so Larimer County is going to be for kind of acute detox is going to be a strong focus there. What we traditionally have handled at Mountain Crest as well as at Poudre Valley Hospital is more tertiary acute behavioral health services. And so they should really complement each other, and we will be providing services at the new Larimer County facility as well through UCHealth. But I view this as an expansion of services, and it won't be duplicative of what's going to be occurring at the Larimer County site as well. And we're excited about both of those programs. We know that as a community and as the state and really as a nation, we're facing a behavioral health crisis, and it is a high priority for us. As UCHealth, we have committed $150 million to expanding behavioral health services in the communities that we're at. I think here in Northern Colorado, the move to Poudre Valley will certainly increase bed capacity and our ability to take care of patients, but it can't end with that. And so we're looking at other new ways to provide care, including telebehavioral health services to a lot of our outreach locations, and we'll also provide 24-hour access for our patients as we move forward. But this is a huge opportunity, and as I've said in many forums, we are, as a community, I think we could be a petri dish for trying to figure out how to provide behavioral health services that are different than anywhere else in the United States. And then we can kind of spread our best practices to the rest of the nation.
Thank you. Also, are you aware, do we have any plans to add geropsychiatry for the aging population here in Northern Colorado? I
think that is it's not immediate, but those are services that we certainly are going to be focusing on once we get our new unit at Poudre Valley Hospital. And so I anticipate that those are things that will be provided, but they are not going to be within the next 6 or 9 months, but will be down the road.
Great. Yes, that new facility is going to allow us to customize care for a lot of important populations.
For sure.
Thank you. Well, that does wrap up the questions that we've received today. If you do have any questions that come to you, please feel free to send them on through to the foundation, and we'll make sure to get those answered for you. We so very much appreciate everyone's participation here today. Kevin, thank you for your excellent presentation. I think as you recognized through Kevin's presentation and through what we've shared about the foundation, there are many critically important services offered to UCHealth patients and families in Northern Colorado that would not exist without your generous contributions. You help fuel our core mission to support innovative research and education, patient financial assistance, community health programs, and enhancements to patient care. If you would like to make a gift today, you're welcome to visit UCHealthNocoFoundation.org /donate, and that link will be in the chat. Again, grateful for your past contributions, and if you're inclined to give today, absolutely welcome your support. Again, thank you so much for joining us. Thank you for being part of making this community healthy and vibrant. We're very grateful for your partnership. We wish you a good afternoon and good health.